Hey y'all, this is Chris Hudson from Drevna-Hudson Physical Therapy. Are you having back pain? Does your back pain increase when you're bending over in the morning to tie your shoes? Does your back pain hurt more when you're sitting for a while? Do you have less back pain possibly when you're up walking? If that's the case, there's a chance that you could have a disc bulge in your lumbar area. So what I want to do is show y'all 3 incredibly good exercises to help to reduce that pain. The first exercise that we're going to do here is called prone elbows. So go ahead and prop up on your elbows. All right, in this exercise, he's completely relaxing his back muscles here. He's not trying to tense up to try to help hold himself in this position. Generally, I tell people to do this exercise for 2 to 3 minutes at a time and 2 to 3 times a day at home. Some people, this might be a little bit too aggressive, so what I would suggest doing is taking a pillow. You're going to prop this pillow underneath of them, and then they're not quite getting the same amount of arch in their low back, but they still are getting an effective arch to help to relieve their back pain with this exercise. All right, the next exercise I want to show them, it's called prone press-ups. And in this one, they are getting in a push-up position. They're going to keep their pelvis and their legs completely relaxed. He is only going to press up as high as he feels that he can without low back pain. If he would press up to here and he would start to develop low back pain, then I would tell him not to come up this high and stay in a range of motion that's safe for him. Generally, I tell patients to do this exercise 2 sets of 10, 2 to 3 times a day. Some people really feel like they get a lot of benefit out of it, so they can do it a couple more times throughout the day, and it helps to significantly reduce their low back pain. The last exercise that I wanted to show you here is called prone. It's called prone biflex knees, and what he's going to do is bring his heels up towards his bottom at the same time, and then take his legs back. When you're doing this exercise, you want to try to go through the full range of motion. But when you get to the top here, you don't want to feel like you're squeezing your hamstrings tight to get your heels as close to your glutes as you can, because sometimes you can get a muscle cramp from doing that. So with this one, I also recommend 2 to 3 times a day, 2 sets of 10 as far as reps go. And if you try all these exercises and you're still having some pain, you're not resolving your low back pain as much as you'd like to, then what I would suggest doing is giving us a call. You can reach us at 717-569-4184. And what we'll do is an initial evaluation in physical therapy. You might need some more specific type exercises to address your low back pain. And you also might need some manual therapy techniques to help get you back to doing the things you want to do and to resolve your low back pain as well. So again, if you need to get a hold of us, 717-569-4184. Thanks.